So let me share some slides with you guys, a little bit of other stuff, just to kind of bring us up to date of where we are right now. So I think I can see Teresa only, so Teresa, just give me a nod or a thumb up that everything's looking good. All right, awesome. So let's see where we're sitting on June 24th, 2021. So I'm going to talk a little bit about where we are today, talk a little bit about some variant information that I think is useful, a little again about vaccine update, and then I'm going to talk about what I see as our transition period. And this is a really important topic to review as we're coming out of the pandemic. So when I spoke to everyone last on an open forum, this was the date. It was around, I think it was about April 13th. We were on the rise of the third wave, and you can see that since that time we've had this reduction. So we really had a hard time through April and into May, but then now we've seen this incredible drop. These are Ontario active cases that are now down below 3,000. What else did we see? Well, we've seen the rush of new cases dropping precipitously again. This is when we spoke last. This is where we are now, and we're well below this. I call this the Evans threshold. This is the 400 new cases per day, which is equal to less than 20 new cases per 100,000 population per day. So we're now well below that threshold. And so, you know, if the government, and I believe they have decided to move to phase 2 a little bit earlier, I don't think there's anything wrong with that, because we've met and exceeded threshold that we had. For those of you who've looked at, and I've talked a lot about test positivity, so that we do a lot of testing here at KHSC. This is the province in red. This is southeastern to central Ontario in the green, and you can see that the province has well gone below the 5% threshold, and in fact today they're at 1.1%, which is where the southeast Ontario part of the province has been for a long time, and we're well below our 1% threshold at 0.4%. Our lab does a lot of testing. You can see here during the height of the third wave, we had on average about 15 positive tests per day, and we're now down to 3.5, and this is going to continue to diminish. A lot of these tests, I will just say, are skewed a little bit by the fact that, of course, we do testing on our own patients, and many have been coming from the Porcupine Health Unit. And in addition, we also monitor and do tests for central east part of Ontario around Kawartha and Haliburton's. If you just look at southeastern Ontario, this number would be less than 1. So what about our active cases? Well, we've seen this precipitous drop. Here we are sort of around the time when I talked last. There was about almost 300 to 500, 400 cases, and we're now down to 14, and we're likely to be into single digits in the next little bit of time. I expect over the next week, the whole Southeast Ontario region, KFLA, Hastings, Prince Edward, LLG will be into single digit active cases. What's happened at the hospital? Here's the surge of cases that we saw coming from the GTA. Many of them initially in the ICU, which you can see here in red. Pardon me. The yellow is our COVID unit. Green are people who have recovered from COVID but were still hospitalized, and they've now accounted for more. And this little blip that we've seen recently is a reflection of that care that we provide, secondary and tertiary care, to the individuals in communities around James Bay. Many of those are now actually on our COVID unit versus the ICU. And of course, with the repatriation that Dr. Pecora discussed, in fact, our recovered patients are now beginning to diminish as they can be repatriated closer to their own homes in the GTA. A quick update on the Porcupine Health Unit, which serves the communities around James Bay and Hudson Bay, as well as a large swath of Northern Ontario. They have been a particular problem with increasing cases, particularly in these young people. This is a heat map by age, and you can see the sort of rate of cases here. Most of these, almost all of them, are the Alpha variant, not the Delta variant. So the Delta variants only popped up in Timmins, which is in the Porcupine Health Unit, but in very small numbers. The other area you may notice here is Waterloo, and they've had a problem with Delta. And that's been occurring mostly in unvaccinated individuals. So that's kind of where things are sitting. You can see the massive effect of double full vaccination in older individuals. This is all blue, other than what's popped up a little bit in the Porcupine Health Unit. This is the effect of how good vaccination is against COVID-19. This is a little map for those of you who are geographically minded. Green is great, yellow is good. Red is not so bad, and purple is not so good. And you can see in this little inset of Northern Ontario, that's the Porcupine Health Unit. It's a health unit with a very small population, so even a small number of cases produces a very high rate of new weekly cases per 100,000 population. But we are looking amazing here in the southeast, and even into the former hotspots in the GTA, they've all gone to extraordinarily low numbers. So this is looking really good. We are in great shape at the moment, I would say that. This is another little map, again produced by a person, a mathematician, statistician I follow on Twitter, Bill Como, here in Ontario. Green is a dropping number of cases, red is an increasing number of cases, and you can see here most of the provinces in green. Don't worry about Kingston here. We have such small numbers that, you know, if we had 2 cases, it goes up to 4. It's like 100% increase. The Porcupine Health Unit actually, quite fortunately, was dropping and continues to drop, and I'm going to show you that in a second. So we are getting on top and control of most COVID hotspots all around the province, and the province in general looks fantastic. This was just about a week ago in Porcupine Health Unit. They had 281 active cases, most in the James Bay, Hudson Bay regions. I just got this data yesterday off of their website, and you can see that they've pretty well halved the number of active cases, and again, still most of them in the James Bay, Hudson Bay region, which is where we are providing care for individuals who require hospitalization, particularly at a secondary and tertiary care level. Quick update on vaccinations across our region. This is KFLA. 75.5% of all of our population over the age of 12, this includes adolescent and youth, are now vaccinated with 1 dose, and we're dramatically increasing our double doses. As you can see here, this is the 2 doses, this is the 1 dose. So the KFLA Public Health Unit looks excellent. Next door in Hastings, Prince Edward, they're up to 74% of their population with 1 dose, 22% with 2 doses. Again, most of the 2 doses are in the older age group, but they're beginning to increase across middle-aged and even younger individuals. I'll explain why that's important in a second. And if we look at Lanark, Leeds, Grenville, they're up to 83% of their population with 1 dose and 20% with 2 doses. And again, 2-dose things in yellow here are being seen primarily in older age groups. So our population is willing to be vaccinated, and this is incredibly important to our control, because vaccination is our way out of this pandemic. Very briefly about variants. So as you guys know, they've been renamed because these numbers were always a little bit hard to sort of go through. The 4 variants of concern we have at the moment: Alpha, Beta, Gamma, Delta. So Alpha was the one that came in the UK, Beta is the one that arose initially reported in South Africa, Gamma in Brazil, and Delta in India. And what you can see here is they vary. The 2 most important ones, Alpha and Delta, have increased transmissibility. I'm going to show you what that looks like in a second with a quick little pictograph. Beta and Delta have a little bit of immune evasion when you look at their response to natural immunity. But this is the really important thing. All of them are effectively managed with vaccine. If you're double vaccinated, even if you're single vaccinated, the protection from serious infection and hospitalization and death is dramatically reduced. And when you're double vaccinated, you're actually protected even from getting infection from these. This is what I'm talking about with Alpha and Delta. So the original virus that arose in Wuhan had a reproductive number where about 2 to 2.5 people were infected for every person who had an infection. The number of people they could go on to infect that were susceptible was 2. When we got the first mutation, which is what we saw here in the Kingston region, as well in Europe and most of North America, which was a D641G, that had gone up a little bit to about 3. What we saw with Alpha, which really emerged in the later part of the fall and early winter in the UK and spread worldwide, is that effect of reproductive number has gone way up. In other words, 1 infected person could transmit it to up to 4 to 5 people around them. And what we're seeing with Delta is an even larger increase in that reproductive number, so that 1 individual who's infected would increase the risk of transmission to unvaccinated people by up to 5 to 8, so up to 8 people. So that's what we're talking about in terms of transmissibility as reflected in the reproductive number. So that's why Delta is a lot of concern. And this is a really cool thing. I'll just sort of show you. This goes back to last summer and takes us up to where we are now. And what you can see here in gray was that early on, and through a lot of 2020, the dominant virus was the original strain from Wuhan, China, and or D641G. But then Alpha emerged in the fall in the UK, and it very quickly dominated the number of infections worldwide. And now what we're seeing with Delta's increased transmissibility is it's beginning to take a bigger piece of the pie here too. So this is the natural evolution of a virus with mutations and variants arise that have a survival advantage. So this is a nice pictograph to sort of see how it looks. Where are we sitting in Ontario? This is data from a couple of days ago. These are clearly Delta variants right here, but I would suggest to you that when we don't detect mutations, as we do in our active screening, those are probably all Deltas too. So Alpha is still the predominant virus being found in isolates across the province, but Delta is like on a billboard chart. It's number 10 and rising with a bullet. The good news about Delta is it hasn't really affected our reproductive number. It's still below 1 here in Ontario, where Delta has been implicated in transmission. The number of cases is still low compared to all the other viruses. It's about half. And this actually looks bad, but it's a reduction. We've seen actually a reduction already in the percentage of infections due to Delta, and that's because of a hotspot strategy where we double vaccinated in areas where Delta was appearing in an attempt to control it, and that seems to be a very effective strategy. So quickly about vaccines, this is just to sort of show you can ignore Novavax. It's not approved yet, although I think this is going to be a crackerjack vaccine. This is Pfizer, Moderna, AstraZeneca, and the J&J vaccines. You can see very effective. Sorry, there's a decimal missing here. Very effective against the early variants. Very effective still against Alpha. Against beta, a little bit of a drop off. This figure is probably wrong because it's based on one study. But even against Delta, Pfizer and Moderna are likely equal. We don't have the data on Moderna. We've only got preliminary data, but full vaccination with either Pfizer or Moderna is going to provide almost the same amount of protection you got from Alpha. So vaccination, vaccination, vaccination. That is the answer, even when we're dealing with variants. Vaccine efficacy against Delta. This is a study from Britain looking where they primarily used AstraZeneca for about half the population, Pfizer for the other half. This a little bit not revealing. A single shot provided an efficacy of about 30% or 1/3 reduction, but when you got double vaccinated, it went way up. But I'm going to suggest to you that this was just looking at overall vaccine efficacy in terms of testing infections. When you look at protection against Delta, which you can see in here with one shot against hospitalization as a surrogate of what is serious versus not serious infection, in fact, even a single shot of Pfizer or AstraZeneca, whatever, protected people from serious COVID-19. So if you've got one shot on you, you are well protected from getting a severe form of COVID, and you won't need to go in hospital, and you're unlikely to die. If you get 2 shots, you do see some increase in benefit, particularly around ones like AstraZeneca, but protective immunity is very, very high. But if we want to prevent Delta from transmitting, then 2 vaccines tends to be a bit of the answer. And then this is just I always put this up because this is a really great study that kind of got missed by some people. This was healthcare workers in the States. They used Pfizer and Moderna, 1-shot protection versus 2-shot protection, amazingly useful. And this is not just preventing you from getting symptomatic infection. This is from getting infection at all. So very, very impressive data with the vaccines. Lastly, this is a table that my colleague Monica Gandhi in San Francisco put together on the issue of transmission of COVID. And what you can see here from smaller studies that have now been published since the beginning of the year is actually there is a reduction in transmission with vaccine. So if you're vaccinated, it's also going to prevent you from transmitting to other people. And really the round off number here is probably 80 to 85%. And that's either because you're not going to get infected at all, or if you do get infected, you're going to shed so little virus if you're already fully vaccinated that transmission is going to be an uncommon occurrence. And we've seen that around the world, particularly in Israel and in Britain. A very quick thing then about the vaccine policy. This is going to be coming to you that we do have a policy that's moving forward on vaccination of healthcare workers and staff and physicians. If you've been vaccinated, all we're going to ask you is to provide proof of vaccination and send that to Occupational Health and Service. You'll get an invitation to look at an online vaccine education module, but you don't have to. You can do it only if you wish. If you have a medical exemption for vaccination, you will have to provide written proof from of the medical contraindication from your physician or nurse practitioner that indicates why and what sort of time period it's applicable to. And again, once that's provided, you'll have an opportunity to look at the online vaccine education module, but you don't have to. If, on the other hand, you elect not to be vaccinated or you're unsure of whether you want to be vaccinated, you will be required to complete the online COVID-19 vaccine training module in its entirety and to have that recorded. After that, no further action is required. Obviously, though, if you get vaccinated after seeing this wonderful education module, then you should report that you have been vaccinated back up to number 1 again. So that policy is rolling out. Going to finish off by talking about the importance here of of the sort of opening scenario. This is a really great graph from a paper that was published just last month. And what it shows is that if you maintain this is called non-pharmaceutical interventions. In other words, masking, physical distancing, all that other good stuff. If you maintain that and you have a vaccine that's 90% efficacious with 75% coverage, this black line here shows that you virtually get rid of COVID. And if you maintain some of these measures in place, even with lower efficacy down to 50% or lower coverage, you still end up with exhausting the pandemic and getting rid of it. However, if you're too quick with removal of public health restrictions and these non-pharmaceutical interventions, then you can actually see a rise if you have like a vaccine that's only 50% efficacious and you've got only 25% coverage. Of course, that's not going to happen. Right now, we're still looking at these sort of curves as likely if we're too fast with reducing these non-pharmaceutical interventions, public health restrictions. So keep that in mind as we talk about what we're going to be doing here in the hospital. So we're now entering a transition period over the next few months. I've said 6 to 12 months generally. It'll depend on how it happens. So what does this mean for us here at the hospital? It means we're going to have a gradual planned easing of pandemic measures that we've brought in place, including screening, PPE use, IPAC precautions, and testing of patients and staff. And it's important for everyone to realize this will not necessarily match the provincial easing of public health measures. And again, the graph I showed you of those models tells us that we have to do this very carefully so that we don't introduce any risk into the hospital as we try and ramp up our care and take care of all the people who have had some of their healthcare sort of deferred during the pandemic. So a reminder, this is our prevention toolbox. This is the one we got to concentrate on. If you're not vaccinated, please get vaccinated. You cannot believe what it's going to do for you personally and what it's going to do for everybody around you and what it's going to do for society in general if we have very high rates of vaccination in the population. Then you can get back to all those things that you've missed that you saw in Dr. Pecora's slides at the start of the presentation. So summing up, where are we, where we're going? We've emerged from the third wave. We're entering our transition year. We're going to see how the coming winter season goes. I'll just introduce that sort of concept to you and see if what we're going to do with our measures, because they certainly help reduce influenza and other stuff. Variants, Delta is a cause for concern due to increase in transmissibility, but full vaccination of increasing numbers of individuals will likely prevent any fourth wave and get us out into that post-pandemic world. And the vaccines, they're effective. They're effective against all the variants, and they're our best exit strategy from the pandemic as we see. So my plea is with you, please get vaccinated if you're not vaccinated. If you're asking questions, please look at the module. Feel free to contact and talk to people. I get lots of emails. I'm not inviting them, but lots of emails from people about what the right thing to do around vaccination is, and I'm happy to answer those as best I can.